All right, hi guys, my name is Carrie and I'm actually going to be presenting work on softball for high school students and the injuries and all the things that go into that. So let's go ahead and get started. So the injury factors, there's environmental, which is the weather, rain, heat. I feel like that's in any sport. Um, of course, in this with the heat, it's you can get heat exhaustion, all those kind of things. So it's so important to stay hydrated and definitely important for the coaches to know and to pay attention and make sure that the athletes are definitely taking care of themselves in these instances. Rain, definitely. If there's too much rain, it can get muddy. It can get really slippery, so that can promote a way of accidentally getting hurt. So it's important with those two that we have to be very careful with those as well. Field accommodations is another thing. I played softball in high school. I mean, I was in the outfield, and most of the time in the outfield it's grass, so you can't see the potholes. So it's so easy just to accidentally step in one and then you sprain your ankle. So I think that's another factor that comes into play. I don't think it's the most common one, but I think that it definitely takes a play. I think that it's proactive that they have people coming out and making sure that the fields are up to par to make sure that there is no injuries. With gender, I found out that women are more prone to ACL injuries. So it's just more common for them to have them. And I think age is a big factor as well. I think as we're younger, we're still developing and all those kind of things. And it's so important that we exercise our muscles for preventative care and so that we don't end up getting injured. But sometimes it's inevitable and injuries happen. And as long as we're doing everything that we need to do to prevent them, I think that that's what we have to do. So the first one that I'm going to be talking about is ankle sprains. This is one of the common ones, and it's defined as a stretch or tearing of ligaments that assists in holding the ankle bones together. Okay, so what causes is the ligaments are stretched beyond their normal range of motion, and that's what causes a sprain. And I mean, it can become more severe. You can break your ankle, and that goes to the bone, but this is affecting the ligaments. Okay. The mechanisms of the injury is how it happens. So a sprained ankle can occur in my sport that I chose is by rolling, twisting, or turning in an awkward way. Quick stopping and starting at bases. When in softball, it's it's not like football where there's running or it's soccer or hockey or any of those things, but there's sudden movements where you have to stop and go because you're stopping at the bases. Am I going to go? Am I going to go back? So it's a lot of stopping and starting at bases. So you have to make sure that your muscles are in your joints and everything are exercised to par for that. And most ankle injuries actually happen sliding into the bases. So you have to make sure that you slide in correctly. I know in high school for me, it was I could not get the sliding thing down. Um, but they say that that's where most of it happens, is a lot of the ankle injuries happen when they're sliding into their bases. The anatomy of an ankle, the one that I'm focusing on is the inversion ankle sprain. And it's the ones, it affects the lateral ligaments. And as you can see in the picture, um, you can see the lateral ligaments right there. And there's the medial and the lateral, but the one that I'm going to be focusing on is the inversion sprain. So it's injured in an inverted plantar flex and internally rotated position. And I mean, you can kind of see since I put the picture here that you can see where the lateral ligaments are, that you tilted it outwards and that's what happened. You internally rotated it. The lateral ligaments actually consist of the anterior talofibular, the calcaneofibular, and the posterior talofibular ligaments. So those are the lateral ligaments that is affected when you have an inversion ankle sprain. The anatomy and assessment of this is a lot of athletic trainers or coaches. The way that you can assess a sprained ankle is using the Ottawa ankle roll. So pretty much it's the inability to bear weight for 4 steps. It's tenderness over inferior posterior poles of malleolus. The inability to bear weight at the time of injury and evaluation, and tenderness along the base of the fifth metatarsals and the navicular bone. Okay, so those are the main things that the Ottawa rules that we go by just to see, oh, is it a sprained ankle? And that's just one way to assess. There's many ways, but this is the way that I have chosen to assess for a sprained ankle. The exercises that I chose for rehabilitative and preventative are the gastrocnemius and the soleus wall stretch. It's I 3 to 4 times a week, 30-second hold in 3 sets. In my video, I demonstrated all of these, and you can see what they are. This one is a stretch, so it's going to be preventative, and you can use it for rehabilitative as well. Stretching is always good before any form of exercise to warm up those muscles. This is the wall stretch right here. So you can see it right there. That's the gastrocnemius. The soleus, the back leg will be slightly bent, and that's going to work the soleus muscle. I'm going to also do dorsi and plantar flexion exercises with the bands. So as you can see here, there's the dorsi, and then there's also the plantar. So the plantar is actually on the top, and the dorsi is on the bottom. And you're going to be doing those 3 to 4 times a week as well. 10-second holds, 10 reps in 3 sets. And the last one that I chose was single and double leg mini squats. Of course, if you're in the rehabilitative phase, you're going to start with the double leg mini squats, and then you're going to move to the single leg mini squats, because of course you're not going to be able to do the single leg on the ankle that's injured. So you're going to start with a double, and then you're going to work your way up. And again, that's 3 to 4 times a week, 12 reps, 3 sets. The next one I'm going to be covering is an anterior cruciate ligament. Most people know it as an ACL, tears and sprains. The main one I'm focusing on is sprains. An ACL tear, sorry, I went too fast there. An ACL tear is an overstretching or tearing of the ACL in the knee. So it's pretty much what it says. And you can see right here, this is the ACL right here in the picture. And it occurs when bones of the legs twist in opposite directions under full body weight. So you do see these happening a lot, and they do happen very commonly in women. The mechanisms of injury, especially in softball, are sudden stopping, jumping, changes in directions, then knee bends backwards, twisting, or side to side. So very similar to the ankle sprains, the mechanisms of injury for these, because that's what softball is. So it's hypertension, hyperextension from a force to the front of the knee, which causes this. The anatomy and assessment is that it involves the knee joint, the meniscus, and the knee is forced into valgus, an internally rotated position with anterior shear. So it's pushed from the outside by an external force on the outside and pushed in internally, which causes the tear or the sprain. And again, I said it's very common in girls. And it also depends on the injury and the severity of the tear. If it's a sprain, we can do physical therapy, but if it's a tear, you are probably going to have to go into the surgery, because it's such a, the muscle is, it just depends on the severity of it. So my rehabilitation and preventative exercises that I chose for these were leg raises right here. And again, 3 to 4 times a week, 3 sets, 15 reps. This definitely, you can modify this depending on the severity of the injury. This is preventative and rehabilitative. So, I mean, you can put ankle weights on that thing to make it a little bit more challenging for yourself if that's what you want. So it all just depends on that. The next one is forward lunges. Right here, you can see it's pretty self-explanatory. Again, 3 to 4 times a week, 3 sets, 12 reps. And the last one I chose were step-ups. I love step-ups. 3 times a week, 3 sets, 12 reps. So again, you can, this one, progressions on this is putting a weighted bar on your back. That's definitely going to add some weight on there, and it's going to make it more challenging for yourself. So most of these you can add progressions to for preventative, and again with rehabilitation, you're not going to put ankle weights when you just had a sprain or a tear. You're definitely going to build yourself back. You're going to build yourself up to that. The next one I'm focusing on is the rotator cuff injuries. There's two different type of rotator cuff injuries that happen. They're acute and chronic. So the first one, acute, is tears and sprains that are one-time traumatic event. So that happens when they're throwing a ball and maybe they throw out their shoulder. That's going to be acute. Chronic, it results from overuse and impingement on the rotator cuff. So because softball is so repetitive in the throwing phasing, it's chronic. It's easy to result in chronic pain because you're always throwing, you're always using that same motion constantly when you're practicing and when you're in games. So it's so important to do exercises to strengthen that so that that doesn't happen. The mechanisms of injury are, for the acute, is breaking a fall with your arm outstretched, throwing too hard to injure the rotator cuff. So pretty much what I stated before. Okay, the chronic injury is, of course, overuse of throwing. And the most rotator cuff injuries happen to pitchers due to overuse and complexity of their throws. In this picture, you can see, I mean, her stance, yeah, she's using her legs, but she's definitely, look at the range of motion in her arm and how much that affects her shoulder and everything. And when you're constantly doing that, there has to be break period time so that they can recuperate and heal. You don't want it to continue because then that's when the chronic injuries are going to happen. The next one is the anatomy and assessment. Okay, so the rotator cuff consists of four muscles. It's the supraspinatus, the subscapularis, the teres minor, and the infraspinatus. Okay, so overuse causes stress, keeping the humeral head centered in the glenoid fossa. So overuse, it causes stress, which it's harder to keep the humeral head centered in the glenoid fossa, and we don't want it to pop out. So the bone involved, of course, is the shoulder. Okay, so that's all involved together there. So depending on the severity, again, the athletic trainer could recommend physical therapy, icing the area. Of course, if they've been pitching a long game, you're going to ice it when they're sitting out, just to help with that. Anti-inflammatory medication and activity modification. Okay, so there's a lot of things that you can use for rotator cuff injuries. It's not detrimental, but again, we want to make sure that we do preventative exercises and that the coaches are teaching them the correct things so that they can go ahead and not injure themselves or have acute or chronic injuries. The rehabilitative and preventative exercises that I chose for this was the latissimus dorsi stretch on the stability ball, 3 to 4 times a week, 3 to 5 sets of 30-second holds. And again, you can extend the range of motion, which will definitely help in the sense of as it becomes more comfortable. If you did have a sprain or anything like that, you extend the range of motion, which will help and stretch that out for you. And that's preventative and rehabilitative. The sawing motion, I didn't have a picture for that one, but it's pretty much self-explanatory, exactly how it sounds. 3 to 4 times a week, 3 sets of 15 reps. And then the last one is the Codman circumduction exercise. It's, of course, you would add weight on there and you're going back and forth and it's working that shoulder and that rotator cuff. And you do that 3 to 4 times a week, 3 sets, 12 to 15 reps. And these are my demonstration videos here, so feel free to look at them. And it definitely shows the more detail of the different exercises, rehabilitative and preventative. And it will they're great videos and they're great workouts to definitely help in this particular sport. And here's my references, and I hope you guys enjoyed the presentation. Thank you.